So moving on to our speaker. Dr. Jared Bly is an emergency physician at the Royal Alexandra Hospital. In addition to his clinical responsibilities, he's an adjunct assistant professor with the Department of Emergency Medicine and clinical lecturer with the Department of Family Medicine. He's also executive director of the Center of Excellence for Emergency Preparedness, a nonprofit educational initiative affiliated with the Canadian Association of Emergency Physicians and the International Federation of Emergency Medicine. Without further ado, I pass it over to you, Jared. Thank you again for being here.
Thank you. Thank you, Michael. It's kind of an honor and kind of an intimidating honor to be here. Today, we're talking about the ethics of disaster triage or medical triage in disasters. Of course, I have no external conflicts of interest. My conflicts are all internal, mainly feelings of inadequacy and inexperience when you're talking about this subject. I'd be comfortable enough presenting to any emergency medicine crowd on clinical emergency medicine stuff. But ethics, to ethics experts, that's a bit intimidating. I'm consoled by the thought that this is a group of ethically minded and morally minded people, so I'm confident that I'll be received at least with fairness or justice or something like that. As for inexperience with disasters, that's of course not uncommon. I haven't been deployed to faraway places in extreme circumstances, but despite our preoccupation with evidence-based medicine, exceptional circumstances are not very conducive to evidence, and localized experience is not always easy to generalize. So a removed philosophical approach to disasters isn't necessarily useless. I do put the website of the Center of Excellence for Emergency Preparedness up there as sort of a bit of a plug for that resource. Um, and again, it's not a commercial conflict of interest, but I'm involved in that organization. So um, we're going to talk about utilitarianism, how it's overwhelmingly cited as a basis for disaster triage. We'll review it a bit as an ethical basis, some of its shortcomings, and some alternative frameworks that are used, could be used, or should be used. So some definitions to set the stage. We won't discuss disasters as used colloquially. So disruption on a personal scale is not a disaster. It's fun to say that breakfast was a disaster, but burned toast, spilled milk, kids late for school, bad hair day, that's not what we're talking about. Even academic resources can totally abuse this word. So you'll read about, there's lots of papers about obstetrical disasters or disasters in the operating room. Again, localized crises don't qualify as a disaster. When we're talking about disasters, we're talking about extremes, many lives lost or disrupted in severe ways, and infrastructure that's incapable of meeting the needs of the crisis. There are dozens, if not hundreds, of definitions published depending on your perspective and your agenda. Naomi Zak is the quintessential disaster ethicist, and I quote from her a lot. And she says a disaster is an event that harms or kills a significant number of people or otherwise severely impairs or interrupts their daily lives in civil society. And I like that definition. So we'll start with the case. Not at work, but you're coming home from work, come across the scene of a horrible accident, and you're asked to help triage at the scene. There's one ambulance waiting to take one patient, and it's up to you to decide which one. So here are your patients. The first one is a tattooed adolescent complaining vigorously of having lost her nose piercing, insisting that you search for it among the rubble and the bodies. There's an elderly man. His eyes are closed. He's not responding. He's breathing shallowly and rapidly. He's clutching his green sleeve to his chest. And you think you can make out goals of care M1. And your other two patients are an obviously pregnant mother who is unconscious, a child at her side, pulling at her deformed arm, saying, "Mommy, wake up, mommy, wake up." The woman is not breathing. So my 10-year-old was looking over my shoulder as I was going through this, and he said, "Oh, that's sad," which kind of surprised me. And then it didn't, because Of course, normal people would think that, right? But not utilitarians. So any textbook of disaster medicine will help you figure this one out by telling you that you have to ignore all emotion and consider the welfare of all. Almost universally, we hear that disaster triage should proceed along utilitarian lines, do the most good for the most people. So we tag the mom and the old man as black or expectant or whatever color or number we use to designate them as too much for too little. And we pat the child on the head because he's okay. And we moved on to the inked adolescent who has a long and productive life ahead of her with just a little intervention. Is that the conclusion you all came to? I won't ask for comments. So help the most people we can. Okay, that's easy to agree on. But does that necessarily mean utilitarianism? Is that the only consideration? Is it the best consideration? Well, let's look just a little bit closer. Utilitarianism is a form of consequentialism, or sometimes it's differentiated from, but they're related. But the morality or the ethics, the goodness or badness of an act is judged by the consequences, as opposed to the other major frameworks of ethics, deontology or duty-based, where you have an obligation to act in a certain way, or virtue ethics, where the focus is on the development of good traits, the character. So utilitarianism is hedonistic, not in the modern sense of debauchery and excess, but happiness. Happiness is the basis for utilitarianism. And at a basic level, that means pleasure and pain. Utilitarianism is actual, focused on actual consequences as opposed to anticipated, likely, or intended. It's aggregative, universal, and equal. So Jeremy Bentham and John Stuart Mill, who are kind of the fathers of utilitarianism, they were economists, among other things. And I think they really wanted something calculable. They wanted to come up with a number, pleasure minus pain, added up for everyone, each sentient being counting for one and only one. Takes away a lot of the complexity, for better or for worse. And utilitarianism is agent neutral, so it doesn't matter whose perspective you're judging it from. So the classic utilitarian dilemma, you're maybe all familiar with this, but there's a trolley speeding down a track with five people tied to the track who will surely be killed, and you and only you have control over a switch which can divert them to another track. On the other track is one person who is tied and will surely be killed. There's all kinds of qualifiers when the philosophers sort of present this, that you can't yell for help, you you don't have any other options. You pull it or not. You kill five people or you kill one person. And you can't use the excuse that you'll just close your eyes and plug your ears, because the really mean consequentialists will say that allowing something to happen confers the same moral responsibility as doing it. So either way, you're a murderer. So a problem that people have with strict utilitarianism is that it sometimes asks you to ignore basic intuitions, basic rights in favor of cold calculations. So another example that comes up a lot is you're a doctor with one healthy patient and five other patients who are all in need of five separate organs, which are all healthy and appropriate tissue matches in your healthy patient. So, of course, if you're going to save the most, you would sacrifice the one healthy patient for the five. It's easy to think of examples where the actual consequences might be different than what is intended. So if you buy a sandwich for someone who's asking for your help outside the grocery store and they happen to have an allergic reaction and die, then you, in buying them that sandwich, have performed an immoral act by utilitarian standards. Hedonism, so there's lots of criticism about early utilitarian theories that maybe there's more to life than pleasure or pain. And so some later accounts include love, beauty, or friendship. But even then, the criticism is that they're incommensurable. So you can't calculate X amount of physical comfort is equal to Y amount of knowledge or N number of laughs. Aggregative or maximizing kind of has the same problem of math not working. So if, for example, in order to save someone's house from flooding, you have to shut off the water to a neighborhood, which means that 1,000 people would have their warm showers interrupted, or it's like 100 if they're teenagers, like mine, versus 10 hours of backbreaking, disgusting, dangerous cleanup for one single person. Then you'd have to let the house flood, right? So if your response is otherwise, your reaction is otherwise, then you're not being very utilitarian. And equality is all good until you want to treat someone differently. So if you take utilitarianism literally, you would say that you have the same obligation to other people's children, even strangers, as your own. Some days, maybe, but usually that doesn't resonate with most of us. And agent neutral to say that it doesn't matter if you're in the hurricane or watching it from the comfort of your own home across the world is it's kind of hard to imagine. And there's some other problems. Is it right to ignore emotions in the disaster or in any situation? Um, Rights came up a lot in COVID, where these tensions came front and center. Individual rights were often not aligned with collective rights or collective benefit. And which one is more important? Is it just a numbers game? What's good for 1,000 people trumps the convenience for the inconvenience for the one? Moral luck. Um, we don't often talk about, but if you happen to have your heart attack on the same day there was this bus crash, that's unlucky. Should your care be compromised? Not to mention the luck of the people in the bus crash. And as far as authority, I won't get into the social injustices, but basically who's making the rules, who's deciding what's best for everyone. Politics really has to be considered in any ethical discussion. So the problem with the trolley problem is that it's not real. As fun as it may be, um, there are a lot of other problems. It's in addition to being imaginary, it's falsely binary. There's misplaced responsibility, false certainties, and I think it's a weak analogy. So um, it's imaginary. Elizabeth Anscombe said, "You cannot compare the moral quality of reality with non-existent hypothetical alternatives." What's really interesting, I think, is that um, Elizabeth Anscombe was a brilliant philosopher and a colleague and very close friend of Philippa Foot, who is the one who gave us the trolley problem. Um, these two, along with Mary Midgley and Iris Murdoch, are kind of like the fabulous four in the 1930s and 40s, intellectual giants in advancing philosophy at that time and since then. But trolleys aren't real, like the Easter Bunny or the Tooth Fairy. Um, my 10-year-old saw this slide too and didn't comment on anything except the Queen of England part. So I guess we don't have to have any deep discussions about the Easter Bunny or the Tooth Fairy. So by falsely binary, are questions ever that simple? Are ethical problems ever simple? We might get to a binary decision, continue life support or not, but even then, they're often much more complicated than that. Does that mean ventilation or vasopressors or intravenous fluid at all? It's rarely a binary decision, and it ignores everything that came before it, all the choices and events leading to the decision, all the possible outcomes and all the ways to approach the problem, binary or not. Is that a logical contradiction, binary or not? That sort of gave me pause to think. So real life is much more like this and and infinitely more complex than even this trolley issue. So misplaced responsibility, thinking about a problem in this way misplaces the responsibility. So whenever I've come across this issue, I think, who put me solely in charge of operating complicated and dangerous public transit? Never mind who tied these people to the tracks. And did they have any role in their being in that situation? I think medical culture is slowly considering systems over individual accountability, but maybe not enough. So the zombie pandemic thing, the CDC put out a campaign that they've since retracted using a zombie apocalypse as a preparedness tool, as if disasters were supernatural, incomprehensible, unstoppable, or our only options are to shoot them in the head or run away or walk quickly because most zombies aren't that fast, depending on which movie you're basing your understanding on. And maybe the point is less about avoiding suffering, but relating to it. So the basic trolley problem always turns and it always gets worse. So there's always a fat man. So now instead of standing at a switch, you're on a bridge with a fat man. And you are certain that you have the strength and opportunity to push this man over. You're certain that he is big enough that his falling on the tracks will stop the trolley. It will certainly kill him, and it will certainly save the five people who are tied to the track farther down. And we're supposed to use this to think about ethical quandaries. Obviously, philosophers have watched too many movies where someone gets stabbed in the stomach and dies within 3 seconds after saying their last words. We all know that people can get shot in the head and survive, and people can die from tripping on the sidewalk. And philosophers are always trying to make analogies and often come up short, in my opinion. So trolleys and floods or landslides or building collapses, can you really compare these? It's like the argument for theism that if you found a watch on the ground, you would assume it had a maker. Therefore, the universe must have a maker. Wait, what? Does that even make sense? It's it's hard to compare. So five sentient beings on one track, one on the other. You're not a true animal lover if you don't pull the switch, right? My 10-year-old son was looking over my shoulder at this one and said, of course he would not pull the switch because then he could eat the lobsters. But I guess not the cat. So the alternatives, or some alternatives to utilitarianism, some of which we use in some contexts and some of which we should maybe use more, are deontology or duty-based ethics, virtue ethics. We mentioned emotion, and we'll talk a little bit more about that. Contextualism, I'll just briefly touch on, and rights. So deontology or duty-based ethics is based on obligations. Usually that's applied to the healthcare provider, where morality is judged on adherence to obligations independent of the outcome. So a more normal case, this is the medical case where all the other ones were philosopher cases. Someone with pneumonia, they have maybe mild hypoxia, antibiotics and treatment are done as per regional guidelines, whether they're admitted or discharged home. And is a bad outcome possible? Of course it is. And if there were a bad outcome, how would that practitioner be judged? Um, we hope and probably would be judged not on the outcome solely, but by on their adherence to guidelines or obligations. Other duties, we're familiar with this. This is foundational to modern medicine. So beneficence, non-maleficence, autonomy, justice. But are some more important than others? There's obvious conflict between a lot of these duties, duty to care versus duty to your family, duty to an individual versus duty to a population. And I would say, and not just me, but that duties take on a more rather than less important role in a disaster. So we'll talk about rights for a few slides. Authoritative sources say things like, it is unethical for a medical professional to persist at attempting to save the life of one individual at the expense of many others. I find that disturbing. Isn't it unethical not to treat the one patient before me than the countless others who are not my patient? Patients have rights. Do responders have rights? Do I have a right not to experience moral injury that could be avoided with adequate preparation? So utilitarianism is explicit in its sacrifice of individual rights. And this stems partly from history. The traditional disaster management is based on military models, hierarchical systems, limited information sharing, command and control, big power differentials. Modern disaster management is much more inclusive of community involvement, and community is key in all aspects of disaster preparedness, which aligns more with a rights-based approach. So emotions, here's another authority. Emotional responses can interfere with the effective triage of children. That's logical and cold and questionable. The second bullet is more in line with virtue ethics, recognizing the importance of emotions and subjective aspects. That it's not wise to strip this process of affect or attitude and focus on reason alone. Humans are sophisticated creatures with an ability to reason that is tempered by our emotional reactions and how we perceive and assess the world around us. There is a subjective component that's necessary. I'm not going to say that there should be one and only one ethical approach. I will say that virtue ethics is critical to the ethics of disaster management. I find it hard to accept that ethics would change in an extreme situation. Ethics don't change, but the application might in a disaster. And a virtue-based approach is actually more adaptable. Algorithms would have to be innumerable to cover all disaster scenarios. And what's most needed in the extreme situation is critical thinking, which needs some subjective input. And virtue ethicists are so virtuous. They're recognizing that not all endings are tidy, leaving room for humanity, recognizing that not everyone can always be happy. All of this means that pain is inevitable and it helps equip us to respond to and relate to others in pain. So Plato identified cardinal virtues, prudence, justice, fortitude, and temperance, fundamental moral habits from which all other virtues derive. And Larkin and Arnold identify these cardinal virtues specific to disaster management. So courage, which has to do with advocacy, integrity, self-discipline. Justice is ethics, but also sort of keeping in check political interests. Stewardship is about attention to the vulnerable and thinking about cost benefit and efficacy of treatments. Prudence is the kind of the opposite of didactic knowledge, so it's experience and common sense. Vigilance, that's kind of what we do in emergency medicine and really medicine in general. We anticipate the worst. Resilience, we're maybe not so good at. That's resisting burnout. Flexibility, maybe we do. Optimism, we don't do. That's another oxymoron that I thought of. I'm not being very optimistic. Charity is kind of the parent virtue, so the ultimate or the most difficult, which is being non-judgmental, deferring praise. And there's a couple interesting themes in these. You'll notice that trust comes up a few times and is connected to different virtues, but team also fits in there in a lot of different virtues in a lot of different ways. And virtues can be trained. So this goes right back to Aristotle, who said that virtues could be or should be trained. And that's echoed by modern philosophers. So again, from Zach, even though extreme situations may seem to call for consequentialist ethics, they may ultimately require virtue ethics because the right actions depend on abilities to deliberate rationally, and such skill requires training and is a desirable professional skill. We don't usually think of virtues as a skill, but we probably should. So, disaster triage, what do we do? And is it the same as what we say we do or what we should be doing? Probably no surprise to anyone here, but ethical guidance is often missing from disaster plans. So systems abound. There's start, jumpstart, salt, toe tags, color systems, whiteboards. There's over 20 published disaster triage systems, tools. Um, and of course, we don't use, um, of course, we don't use a new system when we're in the ultimate high stress, high stakes environment. You could make an argument for this being a good time to have a system to fall back on. But there are lots of other reasons why systems wouldn't be reliable in a disaster. Remember, part of the definition of disaster is that normal systems are disrupted. Power is out, infrastructure is damaged, people are put in roles they aren't accustomed to, etc. And in the Mackey study, the one before that, um, we see that most people fall back on their usual emergency department triage tools in a disaster, with or without modifications from clinical judgment. But it may be more than just a practical consideration. So, is there a better approach than that we're not using when our usual triage approach is overwhelmed? There are often plans, I think, to use alternate standards of care. They call crisis standards of care in a crisis. So this one author calls the altering standards of care unnecessary and dangerous. Um, that's from Schultz. Koenig argues sort of the opposite, that we're not changing our standards of care, but we're changing our care with the same standard. Notice those authors, Schultz, Koenig, both well published, highly respected, and they must have agreed to disagree because they edited a textbook together. So if this is a plan, if crisis standards of care means that we have a plan not to have resources on hand that could or should be, then it's irresponsible. Evidence is hard to come by, but it has been suggested that this approach actually may not even be the most effective at saving the most lives, even if that is all we care about. And again, from Zach, the obligation is to save all who can be with adequate preparation. So response is the wrong time to plan. Of course, the pillars of disaster management are intertwined. It's artificial to consider preparation without considering response. You have to prepare to respond. But planning only to respond is not preparation. Um, some systems have been criticized for considering that disaster preparedness means only response. So, what is preparation for a hurricane when storms are endemic? It's have a go bag and plan to escape your flimsy home when it's destroyed. Or how do you prepare for school shootings? You practice barricading your classroom or repeating protocols like run, hide, and hit as a last resort. So Thomas has written a lot on this, Lindsay Thomas, and she says preparedness, document after document implies, and this is mostly US specific, but preparedness is just about disaster response, not prevention, not quality of life, not social welfare, not justice. Planning and prevention, of course, are key. Whether we appeal to longstanding cliches or modern data, the effect per dollar spent in prevention is proportionately larger than the effect of a dollar in response. But it doesn't make good movies, right? Have you seen any good movies about preparation? Of course not. That would be so boring. Every good story needs some bad decisions or a lack of preparation to set the stage for some conflict or challenge. So your protagonist is walking into the abandoned building alone to search for the monster that's been wreaking havoc, and we're all saying, don't go in there. But what kind of story would there be if the character waited till daylight or got some backup or picked up some spare batteries? There wouldn't be a movie. Unfortunately, it's also politically unattractive to spend public funds on events that haven't occurred yet. So when resource rationing gets left to the first line responders, where we've missed the boat. When we're talking about macro, meso, and micro planning, resource rationing is the macro planning, and it's unfair and unethical to rest the authority of decision making in a complex crisis and morally ambiguous situation with the first line responders. And this is a picture I generated with some AI help just to illustrate. A government is obligated to ensure adequate disaster preparation and planning for all probable disasters. There's no excuse in Edmonton for not being prepared for extreme weather, cold or hot. Um, we don't have to be prepared for the improbable disasters. A tsunami in Edmonton should not get a lot of uh, budget. Uh, Earthquakes, major earthquakes, alien invasions, also probably not Edmonton issues. So, what should we do? There is a role for utilitarianism. This is public health. This is government. It's not exclusively, but in preparation, a lot of decisions will be at the population level. Responders should be trained to respond virtuously. Everyone needs, of course, certain technical or cognitive skills to do their jobs in routine settings. To apply these skills in extreme and morally difficult settings, virtue ethics provides an adaptable framework where lists of rules and roles and policies and protocols don't. Um, I haven't really talked about recovery. Um, Typical of an emergency medicine person. I did mention contextualism, at least community involvement in planning and response. Local needs and resources are best known by locals, and this applies to all aspects of disaster management. Flexibility is applicable across the board as well. It would be um, an oxymoron or maybe just sporonic to put this into a protocol like planning to be spontaneous. You can't really do that. But key to managing ourselves and our resources in chaotic settings is the adaptability and flexibility. It's hard to put that into an acronym or an easy to remember mnemonic or a cookie cutter life-saving course. It's hard to put that into a disaster triage model that can be tested, validated, and repeated. But I think it would be an oversimplification to try to do that, not to mention ignoring some important ethical considerations. So, in summary, utilitarian has a role mostly in that disaster planning. Utilitarianism is about consequences and calculations, and rights, emotions, and virtues are also maybe more important in disaster triage. And they finally solved the trolley problem. It's finally over. You've killed the person responsible for tying all those poor people to the trolley tracks. It's finally over. And my presentation too is finally over.